Housing is one of the traditional areas of concern for public health, although it has been relatively neglected over recent decades. Housing is important for many aspects of healthy living and well-being. The home is important for psychosocial reasons as well as for protection against a wide range of hazards, especially with the current realities of the coronavirus pandemic. The relationship between housing and health is multifaceted. A healthy home needs to have sound structure, free of hazards, provided with adequate facilities for sleeping, personal hygiene, preparation and storage of food, an environment for comfortable relaxation, privacy, and for social exchange with friends, family, and others. Good physical and mental health depends on having homes that are safe and free from physical hazards. In contrast, poor quality and inadequate housing contributes to health problems such as chronic diseases and injuries and can have harmful effects on child development. Poor indoor air quality, lead paint, and other hazards often coexist in homes, placing children and families at great risk of multiple health problems as crystallized by the COVID-19 pandemic. Hazards resulting from lead poisoning irreversibly affects brain and nervous system development, just as substandard housing situations that allow water leaks, poor ventilation, dirty carpets, and pest infestation can lead to an increase in mold, mites, and other allergens associated with poor health. Cold indoor conditions have also been associated with poorer health, including an increased risk of cardiovascular and respiratory diseases. Extremely low temperatures have been associated with increased mortality, especially among vulnerable populations such as the elderly. The lack of affordable housing affects families' abilities to meet other essential expenses, placing many under tremendous financial strain. Families with few financial resources are most likely to experience unhealthy housing and typically least able to remedy them, contributing to disparities in health across socio-economic groups. In order to promote healthy conditions in neighborhoods, there has to be multifaceted strategies which would focus on physical quality of housing and achieve access to affordable housing for all. Government intervention is urgently needed in the area of housing, especially at this time of COVID-19, when the most vulnerable people in the society are housed. Lesser energy and resources would be expended in tackling future outbreaks and spread of pandemics.
The quality and quantity of available housing stock in any country measures the development and quality of life of her people. On housing development, I make it my top priority to bring to you trending housing information and day-to-day housing plight of Nigerians.
If me as a civil servant working for my country cannot get access to housing loan, I don't know what else we can do.
Can you imagine that somebody will pay for 2 years rent and he's not sure of the next 3 months money in his pocket?
I also analyze the housing policies and strategies of government with stakeholders.
Let the federal government next level be seen in the area of housing. Nigeria deserves to be housed.
Housing issue is a journey of 1,000 miles. I don't think that anybody can pretend that we're going to close the 17 million homes gap in 5 years.
Housing development is your one-stop source for housing information. Join me